Hello everybody, today we will talk about cranial nerves and first of all I have to uh, explain the functional components of the cranial nerves, and after that I will use 3D videos and 3D images after that. We have 12 pairs of cranial nerve. The first two pairs arise from forebrain in name of olfactory nerve and optic nerve, and the next 10 pairs of them arise from brain stem. What is functional components? We have some functional components that are very important, and we have three types of functional components: the motor nerve, the sensory nerve, and the mixed one. Motor nerve, we have three types of motor nerve components: general somatic efferent that innervates the striated muscle which developed from somites, and general visceral efferent that innervates the glands, smooth muscle, and viscera and vessels. And after that we have spatial visceral efferent that innervates the muscle which developed from the mesoderm of pharyngeal arcs. And we have four types of sensory component: general somatic afferent, general visceral afferent, spatial visceral afferent, and spatial somatic afferent. General somatic afferent is responsible for general sensation of pain, touch, temperature, vibration, and general visceral afferent is responsible for sensation of distension and ischemic pain from viscera. And also we have a spatial visceral afferent that is responsible for sensation of taste, and spatial somatic afferent sensation of smell, hearing, and balance and vision. I have to say that spatial visceral afferent that is responsible for sensation of taste, they develop from the endoderm in embryologic period, and spatial somatic afferent were developed from ectoderm of embryologic period. And also we have mixed nerve that boasts of the motor and sensory fibers. The first cranial nerve is olfactory nerve. Olfactory nerve are actually neurons. Is the only site in the body where neurons are exposed to the surface of the body. And the primary sensory neurons of the olfactory nerve lie in the body surface in the epithelial lining of the nasal cavity, and their dendrites lie free in the mucous film. And the functional component for olfactory nerve is spatial somatic afferent fibers. They carry spatial sensation of smell from the olfactory region of the nasal cavity and terminate in the olfactory bulb. Each olfactory nerve consists of about 20 minute bundles of non-myelinated nerve fibers, and they pass through foramina in the cribriform plate of the ethmoid to enter the anterior cranial fossa, where they terminate in the olfactory bulb. I have to zoom here, and this part is very important for us. In the olfactory bulb, they synapse with the mitral cells, and the bundles are surrounded by 3 meninges. This provides a potential communication between subarachnoid space and lymphatic of the nasal mucosa. So infection from nose can spread into the meninges of the brain. And clinical correlation. What is anosmia? Anosmia is the loss of the sense of smell, and it can be because of two important disorder such as atrophic rhinitis and ethmoidal fractures. And the clinical test for assessment of olfactory nerve is smelling common odors such as garlic from each side of the nostril with closed eye. And also I will use 3D video after this. First of all, I have to hide some bones such as frontal bone and also maxillary, and I have to hide eye with lacrimal gland, and we have here ethmoid bone. If we fade the ethmoid bone, we can see here, yes, exactly here, yes, olfactory nerves that pass through the cribriform, and after that we have here olfactory bulb. And after olfactory bulb, we will have the olfactory tract here, yes. And after olfactory tract, we will here have olfactory hysteria. Before we start optic nerve, I have to say that you can subscribe us and turn on notification to be the first person watching our videos. Also, we have an account in Instagram that you can follow us. Thank you. The second cranial nerve is optic nerve. It's purely sensory and responsible for vision, and also called the nerve of the sight. The optic nerve is not a true peripheral or cranial nerve. It is actually a tract of the brain for develops as an outgrowth of the diencephalon. Hence, it presents following unique features. It consists of second-order neurons. Its fibers are myelinated by oligodendrocytes. It's surrounded by meninges. Its fibers cannot regenerate if cut or damaged. I have to zoom here and show you this part. Yes, the fibers of the optic nerve arise from ganglion cells, the second-order neurons, in the neural layer of the retina of the eyeball. Immediately after emerging from the eyeball, the fibers unite to form the optic nerve, which pass posteromedially through the optic canal, just here, optic canal, and after enters the middle cranial fossa through the optic canal. In the middle cranial fossa, optic nerve of the two sides unite to form the optic chiasm, just here. Yes, optic chiasm. The middle region of the optic chiasm consists of the nasal part of the retina in each side, and the lateral part of the optic chiasm in the red line. You can see this in this picture are the lateral side of the retina that is responsible for nasal fields of vision. It's so important. And after optic chiasm, we have optic tract that is consists of nasal part of the contralateral side and temporal side of the retina fibers. And after optic tract, we will have lateral geniculate body and lateral geniculate body. After lateral geniculate body, we will have Mayer's loop or optic radiation. The fibers of the optic radiation terminate in the around the calcarean sulcus of the occipital lobe. Some of these fibers from lateral geniculate body, just here, reach the protectal nuclei and form a part of the pathway for lateral for light reflex. Okay, and in summary, our pathway for vision is retina, optic nerve, optic chiasm, optic tract, laterogeniculate body, Mayer's loop, optic radiation, and visual cortex or calcarean sulcus in Brodmann area number 17. And I have to say that the length of the optic nerve is 4 centimeter. And in next slide we have, yes, and what clinical correlation we have here. You can see this figure again, and if any damage or cut or anything happens in the optic nerve, we cannot see the ipsilateral fields of vision, and our vision will just like this. Okay, and any damage or any cut, because optic chiasm is near to pituitary gland, if any adenoma of the pituitary gland press the optic chiasm, and because we will have the nasal side of the retin fibers, and we cannot see the temporal sides of the fields of vision, and our fields of vision will be narrowing, and just like this we will have tunnel-like fields of vision. After this we have optic tract damage. In optic tract damage, our fields will be like this. We call this homonymous hemianopia, because we have fibers from nasal side of the contralateral retin, and the temporal the fibers from the temporal retin of the ipsilateral eye, and we will have homonymous hemianopia.